Good afternoon. My name is Dr. Kim Little, and I'm going to be your professor for Nursing 600 this term, which is Evaluation Strategies for Nurse Educators. I am looking forward to working with you as we dive into learning about evaluation strategies. Now, I realize all of you may not be currently working in an academic setting where you are creating test questions. No worries. You are going to learn some ways to write test questions, and these are applicable in any setting that you are in. Now, just to give you a little bit of background, my clinical background is in women's health, pediatrics, and nursery, newborn nursery. I was a labor and delivery nurse many years ago and then transitioned into teaching. My first job as an educator was actually clinical instructor and then transitioned into the classroom of pediatrics. I have been teaching for 16 years. This is my 17th year, I guess, teaching. I have taught associate degree nursing, baccalaureate degree nursing, and now master's degree nursing as well as in our DNP program. What you'll find out about me is that I love writing test questions. I enjoy looking at scenarios and thinking about them and just trying to come up with test questions on how you might assess something to do with that scenario. I have written test questions for a couple of textbooks, and I just really enjoy what all goes into a test question. So I understand that you may not share that enthusiasm and excitement for writing test questions, and that is okay. My hope, though, is that you'll learn something to take with you, just some nugget of information that you can apply to your everyday walk as a nurse. With that being said, I just wanted to welcome you to the course. Today's Wednesday. It is Wednesday of week 0. So you have a few more days before the course actually begins. We actually start on Monday. I just wanted to reach out, say hello, introduce myself to you, and let you know that I am looking very forward to working with you. This course is pretty fast-paced. You usually have a couple assignments a week, a discussion board and or a written assignment, so it will move fairly quickly. My advice to you as you learn to write these test questions is to choose content that you enjoy and that you are somewhat comfortable with, meaning it's content that you like. It may be your specialty area of nursing that you're working in right now. I tend to write more questions for pediatrics and labor and delivery because that is a content area that I have worked the most in, and so I feel like I have a good knowledge level, a knowledge base in that content area. So do yourself a favor, and as you're writing these test questions, choose content area that you are comfortable with and have more of knowledge in, and then that way you can, after you learn the principles of writing questions, then you can actually apply it to any setting or any type of content area. All right, I'm excited to get started with you all. I will be in prayer for you. If there's anything I can do, please reach out to me by email. We can talk on the phone. I want you to know I'm available to you, and it doesn't always have to be in written form. So if there's something we need to discuss, just reach out to me. I'm happy to pick up the phone and give you a call. I hope you have a great week, and I will look forward to starting with you on Monday.